health research and related data gaps. And then we shall also look at the role of technology. How can we use technology to address the gaps that we are talking about? Then again, confirm if I'm audible.
Yes, you're audible. Yes.
Thank you. So we shall go through some little bit of introduction to give a little bit of a background about why this topic is important. And then we shall take a dive into, mental health research and the related gaps. And then we shall conclude with some role of technology and data science tools on how we can leverage technology, address some of these challenges that we shall be talking about or that we shall have highlighted here. So without wasting much time, the question that we have is, why now? Why should we talk about data, especially in the context of mental health or mental health research? We all know that very many people these days talk about the data, and we are saying data is the new oil. So the data revolution, not only for Africa, really is the talk of everybody, because it leads to a sustainable world in which we are able to use data and generate evidence or information that can be used to plan and to deliver effective interventions, whether at the local scale or at the national scale or even at the regional level. So ideally, we all know that in order for us to be able to speak to several regional agendas, such as the Sustainable Development Goals, the universal health coverage, we definitely need data, because several of those indicators there, they are measurable, and we cannot do much or show progress towards the achievement of these goals or attainment of these goals unless we have data. So that is why data is a prerequisite for delivering the 2030 agenda for SDGs to ensure that no one is left behind. But what is the question? What is the problem? The problem that we have is that there is data sparsity, especially within the African context or within the African continent. And why is that a problem? Is that we have several systemic challenges which pose difficulties for us to be able to achieve informed policy making because of this lack of data. So that is really very important for us to know. Now, I wanted to use the opportunity to talk about why is mental health data important. I'm quite sure that several of you have taken some courses before this session, and some people might have alluded to some of the things. But ideally, mental health data that is specifically focused on mental health is important because it helps us to identify factors that can inform those interventions that have been proven to be effective elsewhere. How best can we scale these interventions? We also need data for that. So we need to identify what are these specific factors that can help us to scale. So for us to be able to scale the intervention that have been proven to be effective elsewhere, we need data. So, and this means that once we have data, we can be able to propose interventions that are context specific, which interventions are likely to work best at the workplace, at the household level, or at the community level, or at the individual level, or for different vulnerable groups, if I can use that word. So it could be gender or different age groups. So that is the importance of the data, that we need this data that is actually context specific. So we need to be intentional when we are collecting this data. The other reason why we need data that is really focused on different aspects of mental health is that we need to increase the volume and the quality of what types of evidence work. So what are these different interventions that are known to be either cost-effective or effective, and that are feasible, and that they can be implemented at different levels of delivery, for instance, within the health sector. So what interventions are likely to work at the national level? What interventions are likely to work at different subnational levels, at community levels, or at individuals? Because what works for one specific community may not work for a different community. What works for one country may not work for another country. So that is really very important that we understand this, which we understand which types of interventions exist. The other reason as why we need mental health data is to support formulation, development and formulation of policy frameworks, and to be able to assess the impact of such policy frameworks on implementation of mental health interventions or on service delivery for people who are diagnosed with mental health challenges or problems. So we also need to understand what interventions exist for under-researched, or other people might call these hidden populations. For one reason or another, maybe because of stigma or something, we really need to understand what interventions exist that can really support or can be easily implemented within populations or for populations that are hidden, that are not easily cannot easily be reached.